Hi, everybody. Welcome to the syllabus review for PTA 213. So you can find this syllabus on Blackboard under course information. So we're just going to do a brief review. So I'm going to be, of course, the professor. It's an online class. It's a continuation of Therex 1. Population of patients that we're going to be focusing in on are neurological patients, cardiac and pulmonary patients. So those are the prerequisites. The textbook is the Martin and Kessler Neurological Interventions for Physical Therapy, the 4th edition, and the Hillegas is the cardiopulm book, Essentials of Cardiopulmonary Physical Therapy, the 4th edition. And there are some recommended textbooks as well. So of course it's an online course, so you need to have regular access to a laptop. A tablet's not going to work for the tests because the tests are going to be online through the testing center as well. So you need to have regular access to a laptop. Again, this is a listing here of the rationale for the course. So again, we're going to be working on cardiac pulmonary neurological dysfunction and all that encompasses. So we're going to be looking at, stroke patients, spinal cord injury patients, traumatic brain injury, and all the different levels of cardiac and pulmonary patients, including coronary artery disease, asthma, COPD, and the like. We are not going to do the service learning project this semester just because of the online method of the class this year. So again, I'll be using the Blackboard Grade Center. This is the breakdown of the course evaluation. There are two exams that are each 20%. The final exam is comprehensive, and then there are some assignments throughout the course in the form of like discussion board assignments, things like Flipgrid, where you do an introduction of yourself, you do some patient education, those types of things. Each week I'll be giving you the my slide deck, which is kind of what I teach from. It helps me organize it. Some students in the past like to organize it themselves. I would use that as your outline as you read the chapters and study, but always leaving space for your own notes, for your own clarifying statements. I try to talk about some patient examples. I know many of you have not, treated a lot of these folks, so I think it's really important to talk about patient examples, and I'll include videos that I think are helpful. I think if you can visualize a stroke patient and visualize a spinal cord patient or traumatic brain injury patient, it makes it easier to discuss, what you might do for treatment, how education for certain patient populations might be more challenging. I do really encourage you to watch the videos. That's going to help. I'm known for those kind of open-ended questions on tests. So if you can have a couple pictures in your head about these types of patients, it will be easier for you to create ideas and answers. For communicating with me, I'm an adjunct, so I have another job during the week. So I don't have set office hours, but I am definitely available, and we can schedule a Zoom or we can schedule a phone call. So the best way to get a hold of me is through email, and we can set up a time. I also recommend that the more you get your questions answered in a timely manner, the less likely you are to kind of fall behind with the content. I do recommend that you also reach out to the tutoring center for help there. Checking Blackboard on a regular basis is helpful. There's a question and answer discussion board. That's where you should put questions that the whole class might be interested in, like when's the test, or I can't open up your slide deck, Sarah. Those are the types of things you can pop in the Q&A, but those are going to be visible to everybody. But if you have a private question about your performance or something specific to you, that's in like personal in nature, just email me directly. And of course, in an online class, the discussion board is really the participation. I try to create discussion board questions that make you think, and I want to see that when you're responding to each other, you're doing it in a thoughtful manner, that you're asking clarifying questions, and because I think, sometimes I think that's the discussion boards are kind of the beauty of online classes too. If I'm teaching the class live, one or two students might participate with an answer, but you don't necessarily get an answer from everybody. And I think the discussion board kind of forces your hand a little bit. So I'm hopeful that can continue to be useful. I was, really surprised last year when I taught this class online for the first time, how rich the discussion board conversations were. I think that ended up answering a lot of questions for students. And instead of me providing the answers, it's exciting to see you guys provide the answers to each other. That's when I know that students are learning too. So it's the same. So again, the tests for this class are going to be online, especially test 1 and 2. Our hope is that the final exam will be in person, but of course that's going to depend on how the college is moving forward with COVID and how the country is moving forward with COVID. But so that those tests will take place remotely, and when we get closer to the exam time, the center will release, sign up time, so you can choose a time to take the class, and the exam center will be proctoring the tests. And those are going to have to be done within a certain time frame. Of course, dishonesty and cheating is not allowed. And, it really doesn't help anybody. It doesn't help you get ready for the licensure exam, which is coming quick. It won't be tolerated by the department and the program. So I also included the discussion board expectations and guidelines, and some just general ground rules. Making sure that you never post in all caps, because that suggests that you're yelling at the other classmate. You can disagree and debate, but do so in a professional manner. I mean, these are skills you're also going to use in the clinic, because you're going to disagree with other clinicians and other staff people. So making sure that you use kind of an appropriate tone, that you're not sending anything that's aggressive or harassing, because that's not going to be tolerated either. And we don't get much out of that. That turns people off, and it doesn't really kind of foster the kind of the learning environment that we're shooting for. Course requirements are similar to that of the other classes in the program. You need to have a minimum grade average of a 75% of C or greater, or you don't pass the class. The more, again, just like I think with the neuro class, there's a lot of content in here that you have to stay on top of it. These are not the types of tests that you can prepare for the night before. The recommendation here from the college is 2 hours of additional study for every credit hour. So this class is a two credit course. So you're looking at 4 hours of studying. I did include in Blackboard for this course the recommendations from the tutoring center. There's a bunch of documents in there about setting up a schedule, plugging in times for studying. Just like you would in your regular life, you also plug in your other commitments, whether they're childcare or employment, but making sure you're also plugging in time for each class. And you want to interact with the content. The more you interact with this content, the better. And you want to interact in a bunch of different ways, whether it's teaching something to each other, you want to read it, you want to write it, You want to draw it depending on the content. This is not all information that you can put down on an index card or a flash card. Some of these ideas are bigger than that. So making sure that you're finding different ways to study and using all your senses, because that statistically through research we know that's the best way to learn. Okay, so I'm going to call it here and then I'll make the next one. Just because we have about a 10-minute window.